I had to sort of go back with my colleagues to the drawing board and started to develop how would an operation of face transplant look like. And if this is the patient, the recipient, whose face was deformed or lost, the idea was that we would develop a way to recover the face so that not only looks human, but it contains all the elements like muscles, nerves, blood vessels, everything that's needed, variable amount of bone. And then the whole thing as one unit is transplanted on our recipient to essentially reconnect all individual elements and allow for functional, not only aesthetic, but functional reconstruction of the face. So microsurgery has been really powerful in a way that it allows us to transfer large or small parts of the human body. You can take part of an ear and reconstruct part of a nose, something that was not possible 20 years ago or so. So using the principles of microsurgery was key to develop the technique, because all of these vessels for face transplant are tiny, tiny in diameter. There are many of them. There are arteries and veins, and there are also nerves. There are about 5 or 6 motor nerves on each side of the face. There are about 3 or 4 major sensory nerves, but up to 6 or 8, depending what you can actually recover what the patient needs. So this is a lot that has to be sutured under the microscope during the operation. Now for us, we tried all kinds of things, but finally it really came down to a hypothesis that we can transplant the face based on facial arteries alone, which was something that we thought should be feasible based on a number of reconstructive as well as aesthetic cases that we've been doing, and our knowledge of facial circulation and relative redundancy of facial circulation. So for Carmen specifically, our plan was the following. On the left side is what we were planning to remove once the scar and the suboptimal skin of suboptimal quality is removed. And on the right side is the face that we were planning to recover from the donor. So we wanted to include the muscles that would provide control of the eyelids. You can see those as circles around the eyes and for the eyelids. And of course the nerves, the yellow nerves are motor nerves, so nerves that would allow her to move the eyelid and close and protect her eyesight. Then we were planning on having the same sort of muscle around the mouth so that she would stop drooling and regain control of her lips, with more musculature on the left side, which, as I described to you, was deeper in terms of the depth of injury, and therefore there was not much of a functioning musculature on the left. And then the kind of dark orange nerves that you may not clearly see, but there's a pair above the eyes, below the eyes, and on the chin. Those are the sensory nerves that essentially provide sensation to the entire face. And these are the vessels, the facial artery and external carotid on both sides that we wanted to connect, as well as the accompanying veins.